It's the fourth leading cause of death in the U.S., and women 45 to 54 are seeing the largest spike in occurrence. This week on Being Well, our topic is stroke. RN Rachel Massey from Paris Community Hospital Family Medical Center will be here to talk to us about the warning signs of stroke, the risk factors, and preventative measures. We've got a lot of great information to share with you, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thanks for joining us for Being Well today. Rachel Massey is here. She's an RN and specifically works in staff development at Paris Community Hospital Family Medical Center. Thanks for coming over.
Thanks for having me.
Well, our topic today is stroke, and this is something that you actually go out to the public and talk about stroke, correct?
Yes, we do a lot of community health programs where we go out and we talk to different groups of women and men in regards to different healthcare topics, and stroke is always a very popular topic to cover.
All right, so I'm going to start first with, tell us, what do you think is the public's biggest misconception about stroke?
I think the biggest misconception is the fact that they think that it's not preventable. On the front side of stroke, the more they know about the stroke, the better off that they'll be. But a lot of folks don't think that it's preventable, like it comes out of nowhere at them. And in all actuality, 87% show that you can prevent the stroke based off of the risks.
Okay, so we're going to talk about prevention in just a little bit, but first, why don't you define actually what is a stroke? Because I know there's two different types as well.
Correct. Stroke is basically a brain attack. I like to refer to it like a heart attack, and the National Stroke Association has determined that if we use the words brain attack, people may pay more attention to that. But what that means is it's a medical emergency, is what a stroke is, in regards to it's a sudden and sometimes potentially hardship on the brain. So there could be damage done.
Okay, so there's two types. Can you explain the two types and which one is more common than the other?
Yes, there's two types, and the first one I want to talk about is ischemic. Ischemic stroke, 87% of all people who suffer from stroke suffer from ischemic stroke. And basically what this is there's a clot in the blood vessel in the brain that sits there, and it interrupts blood flow to the brain, and that's what causes the stroke to occur in that moment. And the medicines that are used for that is what breaks up the clot, and that's what recovers in the stroke. The other one is called a hemorrhagic stroke, and basically what happens is the blood vessel actually ruptures in the brain, and that sends blood into the brain and fills it up, and those are harder to recover from.
Okay, and that does happen less often.
It happens, it's rare.
Okay, so what are some of the causes of stroke?
The causes of stroke start with basically you're looking at high cholesterol, high blood pressure, and again, it's those preventable treatments. So know your family history. And it also has to boil down to diet and exercise. Everything that you would do for a heart healthy diet, you need to have a brain healthy diet as well.
So it sounds like a lot of the same things that, with heart disease are also affected. You can be affected by stroke.
Absolutely.
So are there certain populations out there that we're seeing an increase in having strokes?
Yes. Overall, anyone is at risk for stroke.
Okay.
But we do see that women have a tendency to have a more prevailing diagnosis of stroke. In actuality, the information that comes through the National Stroke Association shows that 55,000 more women are diagnosed with stroke over men.
And what accounts for that, do you think?
Women have higher life expectancies, so they live longer than men. But in addition to that, they also say that women, 2 times as many women die from stroke as they do breast cancer.
Really? And we don't, we hear so much about breast cancer and heart disease. It seems like stroke is it's starting, because we're going to talk about FAST in just a little bit, but for a while it just seemed like something that maybe older people got, you know, or had during, you heard of people having a stroke during surgery, but it's becoming more common.
Exactly. And that is another misconception, is the fact that a lot of people think that the elderly are more prone to stroke, but that's not the case. We're starting to see more and more younger victims of stroke.
I was going to say, can you have a stroke at any age?
Absolutely. It's uncommon, but babies can have strokes, and children, all the way up to the oldest.
Okay.
So it really doesn't identify one population in regards to age.
So we had talked about, you had said women, you're seeing the biggest spike, women between 45 and 54 are seeing more strokes. Are there other, in general, do you see more strokes at by a certain age?
No, there is an influx with that age group.
Okay.
And the reason is that they feel like, and research is showing, that women tend to pacify that part of them. So they're not taking care of themselves necessarily, they're taking care of families and those kinds of things, and they're ignoring their risk factors for stroke during those populations of age. So 45 to 54, they're starting to see a spike because of that, because the women just aren't taking care of themselves or taking care of everybody else.
Okay, so let's talk about these signs that you say a lot of people tend to ignore, but they're very important.
They're very important. F.A.S.T is an acronym that they came up with to help people remember what to do in the event that a stroke does occur. F is facial expressions. So one easy way to determine if someone is having a stroke is to very quickly look at their face, see if it's still symmetrical, if everything still looks the same as it did before. And if they notice any changes, that's part of that facial expression change. And one easy way to assess the face is to have them smile. And when they smile, you'll start to see one side of the mouth droop.
Okay,
so
that's F, and then A?
A is arms. So you have them stick their arms straight out in front of them, and what you'll tend to see with a stroke is that one arm may not be able to be lifted, or it may drift a little bit, and that's another sign as well.
Okay, then we move on to S.
S is speech. Sometimes speech is not immediately affected. They're unable to put together sentences, but the other part of it is sometimes it is grossly affected and they're not able to talk at all or make any sense at all. If you feel that it's somewhat affected, have them repeat a simple sentence, and if they're unable to repeat that simple sentence, it's an indicator.
And then T.
T is time. Time is very important with stroke. In regards to time, the first thing that you do in the initial onset of any sign or symptom is to notify 911. Let them determine whether or not this is a stroke. Seek medical attention immediately. Secondary to that is the timing of when the symptoms actually happened. It's important to remember that part for the healthcare providers and the doctors when you get to the emergency room.
Okay, because we want to talk about some of those medications that they can give you, but I wanted to ask, can these signs be mistaken for something else ever, like slurred speech? Could you be having a major migraine? Do people sometimes maybe pass it off as something else?
They do, and actually a lot of times hypoglycemia, which is low blood sugar, or if someone hasn't eaten, or even a diabetic, sometimes mimic the exact signs of a stroke. So yes, it is hard to determine, but we just ask that you seek medical attention despite. If you're having any deficits or difficulty, it's better to err on the side of letting a healthcare practitioner evaluate you.
So let's talk about that time factor. Someone may be come in from mowing the lawn and all of a sudden they've lost a lot of their ability to move their arm. When should they call 911?
Immediately.
Okay.
Again, time is a factor. What happens is there's a medication that the hospitals can use very quickly, and it's called TPA. It's a fancy word for a clot buster. And what this does is, because most strokes are ischemic, what they do is they'll bring them in and they'll do a scan of their head to determine whether or not they can use this massive blood thinner.
Okay.
And once they determine that they can, there's a certain window that it's effective. And basically, if that medication is delivered within that time frame, the patient or the person may never have any symptoms of that stroke.
Okay.
So fast is better.
So what is that time frame?
3 to 4 hours.
Okay. So if you kind of sit at home and go, I'm not sure what it is, time is ticking away.
Yeah.
So the EMTs don't give that, correct?
That is correct.
Okay.
It's only administered in an emergency room by a physician. So, and again, that's determined only after they've done the test, which the only test for a stroke is the CT and or an MRI of the brain.
Okay, that's what I was going to ask. What can they, when they look at it, can they tell? They can see a blood clot? Is that what they're looking for?
They're looking for initially for bleed in the brain.
Okay.
So they need to rule that out before they actually give that medication, because obviously a blood thinner, and if they've had a hemorrhagic stroke, would make that worse. So initially they're looking for that. Sometimes they don't necessarily see a clot, but it's to rule out whether or not they can use that clot busting medication.
Okay. So why is it that you get this facial drooping, or that things seem to happen on just one side of the body with stroke?
It determines where the stroke occurs in the brain.
Okay.
So wherever the clot is, it could be right, it could be left side. And what the amazing part is, when you do the F.A.S.T, the same side of the face is typically the same side that you see weakness on.
Okay.
So it's a good indicator that that's happening on one side of the brain or the other.
Okay. So do the strokes happen in the brain can they happen anywhere? Or is it usually one side or the other?
They can happen anywhere. It's a blood vessel in the brain,
Okay.
and where this occurs. So it could be a clot that had been forming for a long time typically, or it could be in the carotid artery, or it could be any other vessel. The signs and symptoms remain the same no matter where it's at.
So let's talk a little bit about a mini or a TIA stroke. I won't try and pronounce that. How is that? What is it, and how is it different from what we consider like a major stroke or brain attack?
A TIA is a transient ischemic attack. And basically the problem with that is that the signs and symptoms of a TIA, especially initially, are exactly the same as a stroke. The difference is a stroke is a medical emergency and a TIA is not.
Okay.
And the only way to tell the difference, which you wouldn't initially because you want to seek medical attention, is the fact that the TIA, the symptoms resolve usually in a couple of hours, but no more than 24 hours. The deficits disappear. With a stroke, the deficits remain. So if there's speech deficits or limb deficits with the arms or legs, those will stay in a stroke.
Okay, so if you have a TIA, you will recover from some of that, or you will recover from
spontaneous.
Okay.
Yeah, and you don't need any medication. It heals itself.
Okay.
That's the difference. And the TIA, the definition of that basically is that there has been a temporary blockage in the flow of blood to the brain, whether that's a spasm of the vessel or maybe there is a small clot in there, but it's not big enough to warrant any major strokes at that point. Now a TIA could be a good indicator to a stroke as well. So it is a precursor that there could be a stroke impending, but not always.
Okay, so can anybody get a TIA, or do you see that maybe happening in younger people?
TIAs, anyone can get those as well, any age group. Again, because it could be just a spasm of that blood vessel that causes that to occur, and it mimics the exact signs and symptoms of a stroke. Like
So
I
do
said,
some
it's harder.
people have TIAs and don't even know it, and maybe find out later that they had that?
Yeah. Yes, they do. But then they'll say they didn't feel right and there's some slugginess, or maybe they've had a headache. With anything, if you're experiencing anything out of the ordinary, we just ask that you seek medical attention immediately and let them try to help you work through what it is. Because with the TIA, the physicians and the healthcare practitioners will work with them to develop their plan of care and how to recognize that and when to be worried and when not to, but let them help get them on that right track.
We often hear about people having a stroke during surgery. Is that a TIA, or is that a full stroke or brain attack?
It could be either. With surgeries, what happens is you are messing with blood flow, so to speak. So clots can occur. Surgeons take very special precautions to make sure that that doesn't occur, but it can occur because you're exposing the blood to elements, and then clots can occur. The other part of that is, again, spasms. Surgery is a stressful thing to happen to a person's body. So it just depends on how that body's going to react to the surgery. And most surgeons are aware of those risks, and those risks are shared with patients up front.
Okay. Let's talk about recovery. What kind of determines Let's talk about recovery percentages, because it's actually quite alarming.
It is. Only 10% of all stroke victims fully recover. 25% of those victims have minor deficits. But I think what's more astounding is that 40% actually have moderate to severe deficits, meaning that they may have lifelong debilitations, treatments, therapies, physical therapy, speech, and it's limitless, basically.
Let's talk about what are some of those deficits that people have, of those 40% that don't recover.
A lot of times it can be speech. If it is speech where they're trying to reconnect the brain to learn how to talk again, sometimes they have to see a speech therapist. And what's crazy about it is the fact that they think they're saying the right things and it comes out all wrong. So they really have to relearn how to talk and put sounds together again. If it's a deficit in regards to a limb, an arm, or a leg, those are handled with occupational therapy and physical therapy. And sometimes they have to relearn how to fold towels, or how to put deodorant on, or even how to brush their teeth, because that arm doesn't remember how to do that.
So it's that connection in the brain that's confused.
Yes, and through therapy, they help to reconnect those synapses, basically, to remember what they used to do.
Okay.
Sometimes that comes back, sometimes that doesn't. It just depends on how long they waited before they notified help, where it happened, and the treatments thereafter, and what their risk factors were.
So that's what I was going to say. The 10% that do recover, what did they do differently than the 40% who don't?
F.A.S.T. It's all about F.A.S.T. That timing.
It's all about the timing.
It's all about the timing, and they were quick to respond. And the 10% usually, if it was the ischemic stroke, obviously they got that TPA very quickly.
When you're out talking to people about this, and do you often hear people go, I would be so embarrassed if I think I'm having a stroke and I get to the ER and
Yes.
no, that's not what.
They are, and they're very concerned with that perception. But again, I just kick back and say, what if it was a heart attack? Would you feel the same way? Because the brain is just as valuable as the heart is.
Yeah.
In fact, it's probably more valuable.
It's a little harder to fix the brain.
Yeah,
I think.
yeah.
I mean, we can fix it, and we've had doctors on the show. I'm amazed at what can be fixed, but without your brain, you're kind of in a tough situation.
I think another statistic comes to mind just talking about it. Every 40 seconds, someone suffers a stroke.
Wow.
Every 40 seconds. That's a lot. 800,000 in 1 year suffer a stroke. So it is that important. It's the fourth leading cause of death in the United States. So attention does need to be paid the same way that we finally got attention paid to heart attacks.
And breast cancer and other things.
Yeah.
Are we seeing an increase in stroke?
We have started to see an increase just for the very reason, and they're correlating it with stress. They're correlating it with the fact that people suppress and they don't do preventable health maintenance. I think we're all a little guilty of that, unfortunately. Taking care of ourselves and that recognition of, is this what I really think it is, or do I need to be concerned? So I think in regards to preventing is making sure you know where you're at, understand if you do have any risks, particularly with cholesterol or high blood pressure, or if that runs in the family.
Right.
And then just have an open dialogue with your physician, and more importantly, do preventative health care. We're all guilty of not doing that. And also doing education. So once you know about it, then also taking it outside of that and educating everybody that you know, because it goes a long way.
I was going to ask you about stress. I mean, sometimes when we realize now how serious a stroke is, we kind of say, I'm so stressed out, you're going to give me a stroke. Can stress lead to a stroke? Like if you are really intense about something.
It can, because you're not taking care of yourself.
Okay, so it's not necessarily the stress itself. No. It's sort of the resulting factors
it
of
is.
stress.
It's the getting to that point.
Okay.
It's the high blood pressure. It's the fact that you're not taking care of yourself. And yes, it can in a long way to get there.
Yeah.
But it's kind of like a heart attack. Stress, can lend itself to a heart attack. It's the exact same mechanism. It's just in two different parts of the body. A heart attack is usually a clot in the heart, and a brain attack is a clot in the brain.
Okay, so what can we do? You've touched upon prevention, but what advice do you have for people to do for prevention of stroke?
Again, I think it's just that recognition. I think it's paying attention to your body. Know your body. Know where you're at, the feelings. And if something doesn't feel right, or you're struggling with whether or not, there may be something going on, then have yourself checked out. You owe yourself that. You owe your family that. Just get it checked out. The other thing, again, knowing your risk factors, talking to your physician to even see if you are at risk. There is a risk analysis that healthcare practitioners can do on you. And can identify if you are at risk and grade it, but just based off of conversation. And then that way you know what track you're down so that you can lead yourself into more prevention.
So, but it's still healthy diet, exercise, reducing your stress, all the things that we should be doing anyway for just a healthy lifestyle and heart in general.
Yes, same exact thing actually.
Rachel, is there anything else we haven't covered that you want to tell our viewers about stroke?
No, other than just FAST. Just, face, pay attention to the face, the arms, the speech, and more importantly is timing. And again, I can't emphasize it enough that let them determine whether or not you're having a stroke. You don't need to diagnose that. Let them diagnose that for you.
All right. Rachel, thank you so much for coming over and talking to us about stroke. I learned a lot, and I'm certainly going to remember FAST, and I hope our viewers will too.
Thank you.
Thanks. For all of the high-tech and futuristic technology finding its way into healthcare, a Mayo Clinic surgeon proves that old-fashioned common sense has its place too. How do you make sure a procedure to restore a musician's wind power has worked before you leave the operating room? You just bring a little something extra.
Of all the surgical instruments that come into play in the operating room, the oboe may be the last one you'd expect to see or hear. But in this case, pediatric otolaryngologist Sheila Kofer thought it might be the most important. She's treating patient Mara Reed for VPI.
Velopharyngeal insufficiency. That's just a fancy word that means some air was escaping out the back of her throat and up and out through her nose when she was playing her instrument.
Mara's been in the operating room with Dr. Kofer before. Several years ago, chronic sinus and throat infections called for the removal of her tonsils and adenoids, but not before they had a serious conversation. A conversation about the risks for a highly accomplished musician, such as Mara.
There is a risk of developing this difficulty with playing your wind instrument or even with speech if you take out the adenoids.
And take a look inside the mouth. Relax your tongue. Good. Say ah.
The difficulty looks like this. The little air bubbles you see at the back of Mara's throat are sneaking through gaps left when the infected tissue was removed.
So I'd start noticing that my endurance was lower. I couldn't play for as long as I wanted to, and you'd hear these little audible snorts coming out of my nose, which would sometimes interrupt my playing.
Dr. Kofer's solution is an injectable solution, often used as a cosmetic filler or to resolve urinary reflux in children. Dr. Kofer says it's a safe way to plump up soft tissues. Bringing in the oboe, however, was a first. What better way to put the full force of the woodwind's air pressure demands to the test?
So that we can pinpoint precisely where we need to put the filler material to augment the nasopharynx.
That also meant Mara needed to be awake, only mildly sedated.
But they didn't want to give me too much because they wanted me to be able to play oboe in the operating room because that would give us the best chance of success.
Success is exactly what they got.
Really happy that this all worked out so that I could perform those as well as I can.
For the Mayo Clinic News Network, I'm Dennis Doda.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current and past episodes.